We're joined now by Utah's Democratic Congressman Ben McAdams. He was with us, talked to Hoda a couple of weeks ago, just one day after he was diagnosed with COVID-19. He later had to be hospitalized for more than a week after shortness of breath. Congressman McAdams, good morning. We are happy to see you. Happy to hear you're doing better. But I mean, how are you feeling? What an ordeal.
It was quite an ordeal. Thank you and good morning. I'm doing so much better right now. I'm probably not quite 100%, but after we spoke, it really took a turn for the worse. I found myself in the hospital for 8 days and just had trouble breathing, couldn't keep my oxygen levels up, and just it hit me really, really hard. And so it's good to be back on my feet right now. I'm virus free. I just left quarantine a couple of days ago. So I know that hug from the family, I was able to get a similar hug. It was so great as I left quarantine, and I'm doing so much better right now. I'm still pretty weak. It hit me really hard. And that time that I was in the hospital, but every day I'm better, and I'm resumed work and back on my feet.
Well, this is such a strange disease. Let's talk about the progression of this, Congressman McAdams, because when we spoke, you said it was like the worst cold you'd ever felt. Your chest was tight. You're young. You're healthy. I mean, I think we both thought this was one of those things that was going to end quickly.
Yeah.
And what was it that made you say to yourself, I've got to get in the hospital? And how bad did it get?
So it was Friday night, a couple of days after we spoke, and it just, my breathing just got worse. It got to the point where I couldn't get up out of bed and walk across the room without being out of breath, without panting, and just needing to sit down and catch my breath. And so I called my doctor on Friday night, 2 weeks ago now, and he said it was time to go to the hospital to check in. They monitored my oxygen levels. My oxygen was fairly low, and so they put me on supplemental oxygen and wanted to watch me overnight. Overnight became 8 nights that I was there, and I just never could breathe on my own without that supplemental oxygen and keep my levels up. And so it was quite an ordeal. It wasn't until a week later that my fever broke and I was able to breathe on my own without I was breathing on my own. I didn't have a ventilator, but without the assistance of that supplemental oxygen, and starting to feel better. But it was pretty rough. I tried to talk to my family every day by FaceTime or by telephone, and there were a couple of days there that I really didn't even have the energy to hold up a telephone. I just was laying there waiting for the minutes to pass and hoping that my body would have a chance to catch up.
I'm sure you were thinking, I am young, I am healthy, I have every reason to think that I'll recover, but on the other hand, we've all heard the stories of folks young like you who didn't. I mean, were you afraid as you sat there alone?
Yeah, last we spoke, I felt like it was, I knew it was going to be a rough one, but I was young, I'm healthy, I have no underlying health conditions, I exercise every day, and so I thought it wouldn't be a problem. And that would be my message to people today, is to take this seriously. You don't know how it's going to hit you, how it's going to affect you, and what the consequences might be. And even if you are healthy and it is just a bad flu, you don't know, if you don't take the precautions, who might you infect and what impact might it have on them. So please take this seriously.
Yeah, I was going to say, I don't think there are some people who still aren't taking it seriously. We were even talking about how state by state governors are doing different things in their states. And there's been some discussion of like a nationwide kind of shutdown. Congressman McAdams, do you think that there should be one?
Look, I do think we need to take this seriously. Utah's in the category of not having a mandatory shutdown. I would say we're 80% of the way there. Our governor has told people to stay home. It's maybe it doesn't have quite the force of law, but they have asked people to stay home and for non-essential businesses to close. And so, and most people seem to be adhering to that directive. Our major counties do have a shutdown with the force of law. But look, I think that every state should look at it, and every individual should, whether or not it's required or not, take these guidelines, these requirements from the state, take them seriously, and probably take it a step or two further if you can. Stay at home. Even in Utah shutdown, you're still able to go to the grocery store. But I would encourage people to limit that to necessary trips, or bundle your trips together so your exposure out in the public is limited.
Yeah, because a lot of folks are sick and don't know they're sick. They're not showing symptoms, but they could be spreading it. Congressman McAdams, it is good to see you feeling better. Thank you so much. I'm glad you're reunited with your family, too.
Thank you.
Thanks again.